Just gonna wait a little bit more for those that have just joined the webinar. We're gonna give it a little bit of time for people to funnel into their computers, and we'll start soon after 7. A little bit. Oh, there we go. Dr. Deom's getting all set.
I'm ready.
It's not the suits. It's the custom headwear.
That's right.
You have a mask made for you too?
You know what? I was just thinking, where's my mask? I gotta get it. Hold on.
I'll plant my subliminal Steelers message pillow behind me to convert all you not Steeler fans into Steeler fans. So there we go. Make sure you can see that behind me.
There you go.
I'll wait till 7:01 and I'll give the intro and then I'll introduce you. All right, think we're good, Jimmy? Think we're good to go?
Yeah, right. Ready when you are.
All right, good evening, everybody. Welcome to NJSOP's webinar. My name's, those that don't know, Dr. George Valicki. On behalf of the NJSOP, we'd like to thank everyone for joining us tonight for this webinar on the many faces of dry eye, intense pulsed light therapy, sponsored in part by Lumenis. Lumenis is a global leader in the field of minimally invasive clinical solutions for surgical, ophthalmology, and aesthetic markets, and is a world-renowned expert in developing and commercializing innovative energy-based technologies, including laser, intense pulse light, aka IPL, and radio frequency. Like all webinars, you're able to ask questions throughout the webinar. There's a question poll on a panel on the side of your screen. I will be monitoring questions, and as the webinar goes forward, if there are a number of questions or repetitive questions, I'll let Dr. Deom know. We can stop around 25 minutes after, answer those questions, then there'll be a question and answer session again upon completion of the webinar. So know that tonight's webinar is being recorded so we can make this information more accessible following the conclusion of the program. As usual, we'll email the link to the webinar along with the CE card within a week of completion. I am pleased to introduce our speaker tonight, Dr. James Deom. Dr. Deom is an owner of a multi-location practice in northeastern Pennsylvania. He's a graduate of the Pennsylvania College of Optometry, where he graduated with a dual Masters of Public Health as well as a Doctor of Optometry degree. He served in many roles, including National AOSC President at the time, Local Optometric Society President, and is now on the Board of Directors for the Pennsylvania Optometry Association. He was awarded the Young OD of the Year for Pennsylvania in 2015. He enjoys all facets of primary care, but a special interest in dry eye, brain injury, and scleral lenses. He is the first optometry-owned practice in the state of Pennsylvania to bring on intense pulse light treatments for his patients, and has treated close to 200 patients within the past 6 months. In addition to his impressive optometric resume, Dr. Deom is also a husband, father, and triathlete, long-distance triathlete, I should add, as well as a podcaster of his own podcast called Try Not to Blink, which runs weekly. Again, I'd like to thank Lumenis for their sponsorship and for making tonight's webinar possible. And without further ado, I'd like to introduce tonight's speaker, Dr. Deom.
Hey, everybody. Thank you so much for having me. It is a total honor to be here with you tonight. Dr. Valicki, can you hear me? Good. So glad you guys can join us this evening. I see the numbers are bumping up, and it's a fun way to mix with you all and get with you all and share some information. I think this is a wonderful opportunity for us, especially at this time, to add something new to the practice. I know not many folks in Pennsylvania have this technology. I know many people in New Jersey do not have this technology. So I think I got to meet a lot of you. I got these fuzzy eyeballs on here just to be a goofball. I use those when I have kids. I'll take those off. and we'll get down to business. So if I've not met you, I'm in northeastern Pennsylvania, in Hazleton and in Tannersville. And we have a diverse population throughout the two practices. It's very interesting. The Tannersville population is a lot of New York and New Jersey. So I feel like I'm part New Jersey in a way. A lot of New York, New Jersey transplants that come and retire in the Poconos or move to the Poconos. And Hazleton, interestingly, is a very large Latino Hispanic population. So it's a fun demographic to work between, different groups of individuals than, what I grew up with. And this is my hometown. I grew up here. I swear I'd never come back. And yet again, here I am. So very excited to speak with you about dry eye and in particular, intense pulse light. I've been looking into intense pulse light, bringing it in onto the practice for the last probably 2 or 3 years. And my partner and I were kind of going back and forth. Should we do it? Should we not? We had a LipiFlow unit. We have a LipiFlow unit and MyBiflow unit. And we just were thinking, how many advanced dry eye therapies can we have in our office? We're going to start to cannibalize, one for the other. And the more I learned about it and the more that I found out about it, the more I realized this was something that, as a dry eye practice, we really needed to have at our disposal just for the unique capabilities that it offers beyond just a thermal solution for dry eye and more specifically MGD. No good webinar or presentation is complete without some pictures to the family. It's my beautiful daughter, Bryn, my awesome son, Franklin, and the rock that holds us all together, my wonderful wife, Jillian. That's my son. We've had a lot of time to play and get to be with one another over the last few months, and that has definitely been the silver lining. I want to say I know your state has been hit hard in this time. Ours has too, and certainly my condolences to anyone who has been personally affected by everything that's been going on. So those beautiful faces are my little kids. There's my son after just down in a marshmallow at the marsh. We've been doing lots of fires and he was wearing the marshmallow. They're the kids. This is kind of like a hopeful picture because, usually people take pictures of their kids on their first day back to school. Well, our kids, we're in preschool. My wife's a physical therapist and, I'm here. We were working, throughout the entire time to some extent. And, they were out of school. And so just a week ago, they were able to get back to school, preschool, daycare, but kind of a hopeful moment for us. And we said, let's get out there and mark this day. So you may ask yourself, this is great technology. I've heard a lot about it. I'm excited about it and want to learn more about it. And that's really the goal of this presentation. But I do want to, be aware of the current, times that we're in. And so, here's a patient that came into my office, young Hispanic female in her late 20s. Came in, and if you look really closely above the right upper eyelid, you're going to see she's got a little erythema, a little elevation. She had a chalazion. It was no longer symptomatic. It was elevated. It was bothering her. And she said, you know what, I got this red bump on my eyelid and it's bothering me. And if you really look deeply at her, you look at her skin, you could see there's some blemishes. She's got some oily skin. You look at her hair, it's a little oily also. And she just came from work. I'm kind of giving her a hard time. But if you look at these pictures, you can see she's got some redness. She's got some, maybe some telangiectasias. And, now this is kind of the way I'm looking at patients. Now I'm kind of expanding my view beyond just, the tear film, beyond just the meibomian glands. I'm looking at their entire, aesthetic presentation and basically correlating that back to dry eye, because really, what do we have there? We have a condition that is significantly affected by the dermatological state of the patient. So, this was just a month ago and I've had her back now. We've treated her 3 times. A condition and a patient and a situation where a patient would have never, ever probably transferred into being a LipiFlow patient, for instance. She works in our local Amazon factory, a hardworking young lady. And, I described to her the benefits of this treatment, and she was all on board. And so that's the dialogue that I've been able to communicate with patients. And so I wanted to, when I found out about IPL, I really wanted to learn about the science, because we don't really, let's be honest, we don't learn the science in optometry school. And whether you feel like you understand light, I didn't feel like I understood the properties of light as it really related to dry eye, and more specifically dermatological conditions. And so the idea of this short, but hopefully very informational presentation is to take you from a novice, someone who doesn't have really much experience or background in this area, and hopefully make you feel more like an expert. Obviously not going to be an expert, but you hopefully feel a little bit more like an expert. Maybe, take the next step to investigating a little bit for yourself. Just for your knowledge, there are several folks in the state of New Jersey, optometrists, that do have, IPL units. So, I think you may, whenever you look at a capital investment in your practice, and I'm a practice owner, and I definitely look at the dollars and cents of a capital investment, look at how you're going to pay for that. So you need to know how many, treatments you need to do per week to be able to pay the unit off. And so all I can tell you is how I prepared for that, because I have a partner, we're 50-50, and I wanted to do this, and I wanted to make sure that I could financially make it happen in the practice. And not that he didn't want to do it, but again, we've got a lot of investments in the practice already. And so the way that I did that was I really worked hard to build a list of patients prior to actually getting the device. So for a year, 6 months definitely, but probably for a year, anybody with rosacea, anybody with, significant MGD that, we were already treating, maybe they're on doxy, maybe we did an IP or a Lipoflow and Mibaflow to them before. I was talking to them a little bit about this treatment already, and I was putting their names on a list. And that list then became very valuable, because as soon as we got the device, we called them. And I know from kind of tracking everybody after we got the treatment, that resulted in 5 to 10 treatments a week. And I'll tell you what, that was extremely important, because this is something, again, that we don't have experience in, that we're not familiar with. So to get that experience, to get the awareness of how to use it, what settings to use, how to move your hands and what to do, and how to communicate it to patients, that gave me that experience right from the gate to start to, put this into different positions. We also marketed it. We put out a print ad in our area. Print ads are still a thing. That may not be true where you are, but print ads are still a thing in northeastern Pennsylvania. So I put together this little print ad with a patient picture, showing, the benefits. And again, if you read this, we're talking about dry eye. We're talking about ocular rosacea. I thought the word, eyelid photorejuvenation was pertinent, and maybe a little bit, eye-catching. And so the purpose of this is to, of course, spark the mind. And I've never had anyone bring in a ad and say, hey, this is what I want. I've had that happen several times now with this ad. You're welcome to use it. But this, in the first, couple of months when we were running this ad, resulted in at least 5 calls a week. And I know 2 conversions. And, if you put that into dollars and cents, it's at least $1,000. The other thing with this treatment is that you really need to have some visualization for it. To explain to a patient that I'm going to use light to treat your dry eye is extremely foreign. It's extremely foreign to one another. So for me, I needed to get a bunch of videos recorded, and some short snippet videos, and I'm still, actually building those, so that when I was describing it to a patient, I'm going to hand them a pamphlet and then have them watch the video. We do a lot of videos in our area. We believe a lot in the power of video. We have a local news station that we actually have a TV show on. Dr. Velicki was talking to me the other day, and he said he had a nightmare, and he woke up, he was in a room that video was on loop. I'm just kidding. He said he was visiting the Poconos, and he saw the video and thought it was a snazzy marketing. So I appreciate that comment, Dr. Velicki. And so anyway, that's been a helpful source of referrals also. And the bottom line is, back to my initial statement, you have to be able to look at a capital investment and determine how you're going to get that, revenue back. And so for me, it was a mixture of internal marketing. You guys already have these patients there, definitely 100%. And then the external marketing, reaching out, educating patients about this totally new thing that really resulted in our very surprised ability to pay this device off in 4 months. So when it comes to dry eye solutions, I think, we're all familiar with what we have. We have medical solutions, Restasis, Cequa, Xiidra. We have, the myriad of topical anti-inflammatories. We have omega-3s. Name your favorite omega-3. There's a million of them. We have masks, heat masks, Bruder masks, all the different types of masks, heat-based therapies like Mibaflow and Lipoflow, now Tear Care, and there's a new one out all the time, it seems. But very infrequently you think about dry eye as being an aesthetic discussion. And so certainly when people's eyes are dry, they're red, they're swollen, they're irritated, that's aesthetically unpleasing. It's aesthetically concerning. And we start to think about the way makeup affects patients and how those, the different chemicals and properties and makeup start to affect the meibomian glands. It starts to just tumble down a path that we just really don't go on all that much. And I think that this treatment really lends itself to those individuals very, very nicely. And this guy, you're going to see him a couple times in the video or in the presentation here. Again, this is a patient who I would have never ever, I've tried, he's been a patient of mine for several years, gotten to convert on a Lipoflow or Mibaflow. And you can look at this gentleman, look at him. He's got very pronounced telangiectasias on his nose. He's got some rhinophyma on his cheeks and on his chin. You could see that. And here, so I described the treatment. This is a treatment that's been done in dermatology for many years for, for rosacea, something that I think you're very well aware that you have. Did you know that rosacea also affects your eyes? And so you can see, the after treatment here. This was after one treatment. Just look at the telangiectasias on his chin, on his cheeks. And you may say to yourself, well, what are you doing there? Why are you treating that? And so we're going to get into that in just a moment. So let's just get the elephant out of the room, okay? Let's get it out of the room, because this is what's holding all of us back. We were the first optometry-owned practice in Pennsylvania to invest in IPL. Why? Because we're concerned that, folks think that we're not capable or allowed or legally able to do it. And so naturally, optometry is a legislated profession, something you're all very familiar with. However, it's very important to understand this. IPL is not a laser. It is not a laser. And so, in the past, there were units that had IPL and laser. It was all in one. You just click the button, it turned into something else. That got a lot of people worried. And so it's important to understand the science. The science is that IPL is not a laser. There's some very specific differences that make a laser and IPL. And the first is that it's a monochromatic versus a broad spectrum of light. So it's not just one wavelength, it's many wavelengths. We're going to talk about why that's a benefit. It's not coherent, it's incoherent. So they're not in phase, they're out of phase. And so you don't even need to necessarily worry about this right now. But the purpose of understanding this is to know that at its very root, there is nothing about IPL that is laser or laser-like. They are very, very different. And so the way we're going to go through this is we're going to actually talk about the basics and the science of light. We're going to talk about the dermatological anatomy that you should really understand when you are treating dry eye, when you are treating this condition with IPL. We're going to talk about how those two things work together. We're going to talk about how I approach dry eye. We're going to talk about the various protocols that exist and how to implement it in the practice. So the basics of light. Well, I think we all think we understand light really, really well. And that is, we get light from the world. Really, every object around us emits some form of light. And then we have the power, and the eye has the power to bend that light. And we can use things like lenses, bent lenses, and different powers associated with those lenses. And so we're familiar with this, terminology and dioptric powers and be able to bend light. But we're not familiar with something like this, how we use light in a certain power, in a certain fluence to affect the change on a target. And that's really what we're talking about here. So when it comes to light, what is it? It is an electromagnetic radiation. Okay, so we have light that comes from the sun, right? The sun emits all of the electromagnetic spectrum, and it has electrical and magnetic properties. And so there's an electrical field and a magnetic field, and the properties that determine what type of electromagnetic radiation we're dealing with have to do with wavelength and frequency. And that really folds in nicely to the conversation about IPL. And so we use the IPL device, the handle there that you see me holding, on the patient to affect change on their skin. You can see in this patient has a beautifully rosy cheeks. You can see we just treated her cheeks. Those are not nails in her eyes. Those are laser grade shields that we use right here. You can see the laser grade shields that go on the patient's eye to protect their ocular the globe and the structures of the eye. So let's get into the properties of light. So wavelength, something you probably all remember from, first year of optometry school or physics back in undergrad. So what is a wavelength? Well, it is the distance between one crest to another crest, or one trough to another trough, the physical distance. And so I love this analogy of the ocean. So we have a choppy ocean with a ton of waves, and those waves are usually, when it's choppy, very close together. And then you have this beautiful glass sea, this beautiful flat ocean. You have some, ripples, but they're very far apart. And so naturally, when you have those two situations, there's different consequences. And the consequences have to do with the energy that's produced. And the energy between a shorter wavelength or a choppy sea is what we call a frequency, a high frequency. And the opposite is true for longer wavelengths and a lower frequency. And so we can think of that as an energy. So shorter wavelength, higher frequency, more energy. And so when we think about energy, we can speak about it just like we talk about the power of the lenses that bend light. We could talk about the power of energy, the power and energy of light as we're directing it at something, and that's the unit of joules. And so we're going to talk about joules, and you'll get to understand and learn about joules as you use the IPL device and get comfortable with it. And so the way that we talk about joules in the IPL device is in a surface area. So we're going to apply a certain amount of energy, a certain frequency or wavelength in a certain area, and that's what we call diffluence. And so again, you have a choppy ocean, shorter wavelength, higher frequency, more energy. It's going to spin that windmill faster. You're going to get more energy out of that. And so that's what I want you to think about. Shorter wavelength, higher frequency, more energy. Here's the electromagnetic spectrum, something we're all familiar with, something that we all probably are well aware of, but thinking of it as a high energy and low energy type of delineation is maybe not something you knew. And so visible light actually exists in this low energy delineation. That's what we're dealing with when we talk about IPL, or intense pulsed light. And so, the bottom line is light is used in many, many, many facets of healthcare. We have radio waves that are used in things like MRI. We have microwaves that are used in some forms of cancer therapy for breast cancer. Infrared treatment, infrared uses are everywhere now. We're screening everybody's temperature before they come into the office. The visible spectrum, right? The visible spectrum, you might think about SADS, or seasonal affective disorder, where we're sitting in front of a form of light. Even syntonics, right? We use all sorts of different lights with syntonics. UV light you're hearing a lot about right now because of its ability to kill pathogens and viruses alike. And X-rays, of course, we're all familiar with, and gamma rays in gamma radiation and gamma ray, like the gamma knife here. So intense pulse light is visible light. It is a form of the electromagnetic spectrum. You can see it. And it definitely provides an energy, and that energy can be altered based on the device. And so here you can see a picture of me utilizing the device. I have the foot on the eyelid here, and you can see we have the shield over the eye protecting the globe, and we're treating this patient. And so what we're doing with IPL, very important, and I always bring it back to this, we're treating the skin to improve dry eye. We're treating dry eye period. Always. I am always addressing dry eye with this treatment. And so how does that work? Well, IPL is a very specific type of light energy, and that light energy is produced in such a way that it is absorbed in the body by really two things. And this is really what you need to understand for all of how IPL works. It is absorbed by pigment, and it is absorbed by blood, and is specifically absorbed by a part of blood called oxyhemoglobin. So pigment and blood. So it's a very specific type of light in the visible spectrum. We have the power to determine which wavelength we want to use in the visible spectrum. And then we're going to place that on the eye to then affect change where the energy will be absorbed by pigment or blood, okay? So here we have a little picture here that shows you how we do that. So we have these filters on the right. So the filters, what they do is they block wavelengths that are beyond what the number of wavelength is. So it's, again, in the visible spectrum. So somewhere between 400 to a little over 1,000. And so you can see that as we use different wavelengths, different frequencies, we can allow the light to penetrate to different depths of the skin, thereby affecting different targets. Very important. So you can see the various filters and the various cutoffs that we have that reach the different depths in the skin. And so really, you know, I'm going to skip through that right there. We'll come back to that if we have time. I think we're at a quick little stopping point here, Dr. Vilicki. Are there any questions?
We have one question that's been posed. A good question, Dr. Deom. It's if you could take one device with you and one device only, which would it be, given the choices of MyBaflow, LipiFlow, or IPL?
I mean, it's an unfair question right now, but obviously as I'm delivering this presentation, but you know, I mean, just to be honest, you know, it would have to be IPL for the reason that I will cover, but primarily, you know, we think about LipiFlow, when we think about MyBaflow, it is primarily a thermal-based solution. With IPL, we have a thermal-based solution with anti-inflammatory properties. That is not true of any of the other treatments, and there's science to back that up, and we're going to review that. So for the very fact that we have the anti-inflammatory as well as the thermal effect, with the addition of the fact that you can tailor it, you can really be a little bit more flexible and tailor it to the patient and repeat it, and that's a really nice feature, I think, that you know, IPL has as far as outshining the other units.
Another question would be, is the efficacy of the treatment with IPL dependent upon the level of pigment that the patient has in their skin?
Yeah, definitely a very important topic and very important issue, something that I will cover just in a little bit more detail as we move along. So I won't go into deep detail about it, but the bottom line is, as I said, the light is absorbed by pigment. When light is absorbed by the target, it creates an effect called thermophotolysis, where we're actually going to be getting rid of that target. And so we do not want to, of course, in somebody who has more pigment, get rid of that pigment without, you know, that discussion taking place before. So if somebody has darker skin, you know, we're talking about an African American or Hispanic or Latino, Asian individual, somebody from Middle Eastern descent, we're going to really try and be careful about that. I will tell you that we have had success in those patients. We just have to alter the settings to make sure that we're not adjusting their skin pigmentation.
Okay, I think that we can continue on. Some of the questions that are coming up now, I think, would pertain to the treatment, and I think you're going to get into that in your presentation.
Yeah. Awesome. Everybody get up and do one of these. You ever saw those guys that are wiggling around out in the sun, out in front of a car store? You got to do a little wiggle every now and again, get some blood flowing, and we're good to go. All right, so basic dermatology primer. Basically, what we're going to talk about here is how the light interacts with the various levels of the skin that you want to be treating. And so I think you're all familiar with this. Whether or not it's something you've thought about at all recently is probably another question. I know it wasn't for me. And I will tell you, and I brought this book along, there are no books for IPL and dry eye. There aren't any. It's not a thing that's really been written about. And so, you know, I bought this book. It's called The Aesthetics Application of IPL, and a lot of, you know, what I'm giving you here tonight is stuff that, you know, I had to go out and take from other sources of IPL use, both in the dermatological world and the aesthetics world, to give you this information. And so here we are with you know, our dermatological primer. And so we start with the epidermis, the most apical layer of the skin. It's a 0.1 millimeter thick, about the thickness of a piece of paper, okay? And it's avascular. So I don't know, you know, maybe many of you know that, but I never really thought about that. It's an avascular tissue, kind of interesting. It's 5 layers thick, and so it's very similar to the cornea, right? In a way, it's very similar to cornea, with the exception that it's actually pigmented cells in there. So that's where the pigmented cells reside. And so when we think about addressing the pigment and pigment being absorbed and having lysis of pigment, this is where much of the pigment is, in the melanocytes secreting melanin into the various layers of the epidermis. And so, you know, as we think about the various levels of treatment, as we think about the depths of the treatment that the treatment may go to, when we look at the depth of the epidermis, we are thinking about, you know, usually those up here, you know, in the 380, 450, 450 to 495. Those are going to be the ones, the shorter wavelengths that go ahead and get us to that level right there. Okay, so epidermis. So what are we going to be thinking about when we think about epidermis? Now, I just want to say, what I'm about to talk about is not something that you need to, you know, say, well, I'm going to go out and do this. No, you don't need to do that, but you should be aware of what the device does. You should be aware of what the device is capable of doing. And so for that reason, this is why I'm reviewing this. And so as the light transmits down through the layers, you're going to hit the layers above it, even though it's not going to be focused there. And so the first thing that we're going to talk to you about is acne. Okay, and so one of the most apical areas to treat is the bacteria buildup on the apical surface of the epidermis. And so, you know, we know that that is a reason why the glands around hair follicles and glands of the skin can get clogged up, infected, and eventually cause acne. And so it's been shown and studied, well established, that the shorter wavelength cutoffs for IPL can clean that bacteria up, get rid of it. And so this is actually one of the first applications for IPL. Hey, Dr. Velicki, is your mic still on? There we go. Do you mind just muting it? I think I'm getting some feedback.
I'm muted.
All right. Good. All right. So that is acne. Okay. And so that would be the first application. Okay. And so the second application, again, we're in the epidermis right now, thinking about the most apical way of treating the skin. And so what do you see here? You see sunspots, right? You see sunspots. You see some little spots of pigment on this woman's cheek. And so when we think about this, we think about pigment. Where does pigment exist? It exists in the epidermis, the outer layer, avascular layer of the skin. And so sunspots, is this an application? Absolutely. Why? Because as I said, the light, the IPL is going to be going into the epidermal layer, and you could focus it on that area. So if you look at the 515 right there, the 560, that 560 is going to be allowing light to focus down into the more basement layers of the apical layer, which is the epidermis. So here you could see a little bit of a time lapse of a patient that had IPL, and you could see what happens to their pigment. The pigment actually travels apically and basically sloughs off. And so what you see is a phenomena called coffee grinding, where that pigment travels upward and then sloughs off. So now we're in the dermis. So dermis, D is for dry eye. I love this because this is where this is our playground, the dermis. And so the dermis is where the vascular supply is. This is where we're going to be focusing our primary attention. That's where the vascular supply is. And when we think about abnormal vascular supply in the dermis, the big thing that comes to all of our minds, and I've said it already several times, is rosacea. We don't really know what causes rosacea. We think that there is probably a significant genetic composition to it. And what happens? Well, we have inflammatory molecules bringing other inflammatory mediators to the area, dilating the blood vessels, creating abnormal blood vessels, and as a result, creating this state of chronic pro-inflammatory unhealthy glands in the skin tissue. And what is the eyelid but specialized skin? And so for patients that have very obvious rosacea on their face, on their nose, on their chin, you need to look deep at their eyelids, look for those dilated blood vessels. And the opposite is true also. When you're looking at their eyelids and you see those dilated blood vessels on the lid margin, look at the skin, take an extra moment to observe them. So, here's a patient that I had. I just think this is so amazing. This is his cheek, right next to his nose. On your left side, you could see, initial presentation, dilated blood vessels, very anomalous and irregular, significant rosacea. And this is after one treatment. You can look and just see the benefits that this treatment has in reducing those blood vessels. And the theory is, and when we squinch down those blood vessels, get rid of those blood vessels, then they're not leaking pro-inflammatory mediators into that space, thereby decreasing the quality, texture, color of the skin and the glands that support the skin. This is, again, another patient that I would never see converting to something like an IPL. When we start to talk about the quality of the skin, how that affects dry eye, how that affects, the meibomian glands and the quality of the oils that go onto the ocular surface and the consistency of vision, the conversation totally changes. So pretty impressive. So again, we're in the dermis. We're using those filters that allow for the penetration of the light into that basement layer of, the apical layer of the dermis. You could see right at the top of the dermis are where those vascular loops live. Hair removal. Oh my God, he said it, hair removal. We're not removing hair, right? This isn't the aesthetic spa. True, but this is what the device does. You need to be an expert about this device. You need to understand it. You need to be aware of it. And so I'm not going to go into the depths of what hair removal does, but boy, could we use this for trichiasis? Could the light that we use stimulate the reduction or the removal of the growth of some of these lashes? We're pulling these lashes all the time. Here I have an elderly young, elderly young, I can say everybody's a young man, a young woman when I walk in the room. So I have an elderly young man here, and you could see on the left-hand side, the before and after. And you could see we did a treatment where I actually used a deeper setting right on the lid margin to get rid of some of those lashes. And so, this has been successful. I've done it in just a handful of patients. I consulted with Dr. Laura Perriman about this. I saw her talking about it and posting about it. And so I gave it a try, and really impressive. I mean, you look at the quality of skin, look at the lid. This guy's a lot happier. He's more comfortable. I also feel like it's helped a little bit with the entropion. I don't have a big, study to prove this, but what are we doing? We're going a little bit deeper to the basal level of the dermis, where the vascular supply supports the bulb of the hair follicle. And certainly, is not a perfect solution. This isn't a surgical solution. IPL is not surgery. It's light at various levels to affect change in the tissue. What about wrinkle reduction? Oh my God, you're talking about something that's not dry-eyed. Stop talking about it. You need to know about what this device does. You need to be comfortable with it. And so, do I ever tell a patient, boy, you're going to look younger and more beautiful and, all your wrinkles are going to be on? No, we're treating dry eye. That's the purpose. That's the goal. That's what we're going to do. We're going to see this. So, here's a patient. actually use something called the vascular setting on this patient. It is a certain filter that allows for light to go into the dermis. The area that I just described to you has most of those vascular areas, vascular loops that we're treating for dry eye, and then the deeper layer of vascular supply at the back side of the dermis. It's called the vascular setting. It really gets some of those deep, stubborn telangiectasias. And you could see from left to right, you know, before and after just one treatment, how much better, you know, her skin looked, and her eyes just felt much, much, much better. And so, you know, this is just a depiction of the yellow is where the wavelength is actually going. So you got a shorter area in the more apical region where we just showed you there were those vascular supplies that are often responsible for the inflammation, and then deeper also. So 2 areas, that's the vascular setting. That's a very specific type of filter. Light and skin interaction. So what can light do with the skin? So it can reflect, it can absorb, and it can scatter, something we're very, very familiar with. And again, we talked about what IPL does. It's light absorption, which we have a fancy name for it. It's called photobiomodulation, where we're affecting change with light. It's absorbed in by the melanin and the specifically oxyhemoglobin in blood vessels. That's what the light is going to be absorbed by. And when it is absorbed, something happens. It's called photothermal lysis. And so we can alter the effect of photothermal lysis. So it's not just the wavelength. We just talked about the wavelength and the depth that the wavelengths go, but we can also alter the power. So we could use our device to alter the power. We could use our device to alter the wavelength, go to different depths. And we also have the power to use different what we call footprints. So here we have a larger footprint. You can see that larger footprint there, and the larger spot size will penetrate a little bit differently than what does the shorter footprint. And I'll show you, I got the shorter footprint on the device here. This is the handheld device. There's the shorter footprint that works great for the eyelid. And so you can see how the shorter footprint does not go quite as deep, which makes it a little bit safer, better for the eyelid, because the medial eyelid tissue happens to be the thinnest skin tissue on the face. So pretty customizable, which is a really great feature. So, you know, how does it work? How can you just shoot light into the skin and it just affect one thing? Well, the way that it works is something called selective photothermolysis. And so I like to use this analogy. My wife loves her coffee cup hot. She likes her coffee hot, but she likes her coffee cup hot. I don't really care. I just want to drink my coffee and then have another one and maybe one more. And I'm having one right now. You're probably saying he doesn't need one. But she really likes her coffee cup hot. Now, how do you get your coffee cup hot without spilling the coffee over? Well, you got to put the coffee cup in something, heat it up probably before you put the coffee in there and microwave it. And so this idea of selective photothermolysis is very important. And so what we have is something called the thermal relaxation time and the thermal conductive time. And so what happens is you heat up something for a period of time. Okay, and when you heat it up, you then wait. And the time that you wait is going to allow for the thing that you don't want to be ruined, in this case, the coffee, to completely cool down to no heat at all. But some heat will be retained in the cup. And so you can keep doing that. You can supply 5 seconds of heat and then 7 seconds of heat. And during that 7 seconds of heat, you're going to get some heat in the cup and the coffee is going to go down to 0 heat. And so what you are able to then do is selectively heat up the cup and not the coffee. And so this is what happens with the skin in IPL. So on the left-hand side, you could see what we're doing with our target. And on the right-hand side, you could see what we're doing with everything else. The stuff that we don't want to burn or affect and lyse, like the skin. We're going to affect change in the vascular supply in the skin, but not the skin itself. So we're not going to burn the skin. So that's really putting the pulse in IPL. We're pulsing it. And so you could see these little sine wave type things. Those numbers there are the time, the seconds, the milliseconds that we're doing a pulse. And so you can see that triple pulse setting right there. That triple pulse setting is going to be 6 seconds of energy followed by 50 seconds of no energy. And so we know that the thermal relaxation time of the skin is about 10 seconds. So that right there, that triple pulse, is going to be the setting that you use for meibomian gland dysfunction. And so you can see that there's plenty of time for the skin to cool down, and it's a very safe treatment. So you're getting the energy to the vascular supply, and you're allowing the skin to cool down in the meantime. Dry eye. Now, some of you may have heard me talk about dry eye before, something I'm very passionate about. I think, educating folks about it is extremely important, talking to them, priming them from the doors. We have a huge sign outside. We do lots of, various types of marketing. We really engage our staff in being part of triaging patients, getting the history, talking about, what sort of medicines they may be on, really meticulously measuring their visual acuity for any type of fluctuation in their visual acuity. A speed questionnaire, I think, is invaluable, especially in patients that you're going to be treating with IPL. I do it before every single treatment. So for me, we're interviewing the patient, we're looking at the patient. We are, of course, doing a refraction. We're staining with lissamine and fluorescein, and we're taking a good look at the front of the eye. When we see something, I'd love to show the patient, hey, look, these are dead cells on your eye. Hey, look at these oil glands. They are slowly atrophying, and we really need to affect that. But I think beyond that, I'm starting to look at the quality of the skin, the quality of the dermatological state. And it's interesting, you have patients come in who are not wearing their makeup. When you ask them to come in, don't wear any makeup because we're going to do the treatment. It's unbelievable what's hidden under there sometimes. But these are just some beautiful pictures of keratitis, and definitely a huge advocate of lissamine and fluorescein. A busy slide, but one that's very important nonetheless, and triaging and how you get to the figure out, does this patient have dry eye? And so many times, I think in historical sense, we thought of aqueous deficient and evaporative, and really those two houses are just a continuum. And there's various steps, right? Once we determine what we're going to do, we're going to have various steps. And basically step one is let's think about your environment. Let's think about water intake. Let's think about maybe using some artificial tears, a very mild step. And then big important thing, follow up. Number two step is really our beginning of therapeutic treatment with prescription eye drops. And interestingly, whether you knew this or not, this all comes from the dry eye workshop. IPL is listed as a step 2 treatment. Step 3, of course, a little bit more advanced, autologous serum, maybe amniotic membranes. Step 4, some continuation of that. And so how do you make this work in your practice? You need to believe it. You need to believe that this is something that works, something that you are an expert on. Your staff needs to believe it, and your patient will then trust you. And so I think you need to understand the research, and I won't go into the details of each and every one of these studies. They'll be available for you to review, but suffice it to say, there's some significant research out there that shows that IPL not only has the benefit of a thermal effect and heating up the glands, melting the oils, and secreting a better quality oil, but also in the anti-inflammatory world also, we also have benefit there. And so here you could see the dreamy eyes of Rolando Toyos. He's the one who really got this ball rolling. And when he saw in his aesthetics clinic, when treating patients with rosacea with IPL, that they got better dry eye symptoms. So here you see a collage of patients of mine that I've treated that have a darker complexion and have benefited from IPL. I have a patient of Indian descent, Asian descent, as well as 2 Hispanic and Latino patients. And this is a study that showed benefit in patients with Asian skin types. And so can you do it on patients with darker skin pigmentation? Absolutely. Just need to make sure that you're using the correct settings. And so again, some other photos of patients that I've treated. This is a great study that showed, improvement in meibum quality, improvement in oil patterns through interferometric readings. This is a study that, again, compared some different forms of treatment and used IPL as a comparative measure and showed benefit when using IPL and meibomian gland expression. This is a pretty interesting study. It actually showed that there was an improvement in meibography and meibography morphology. So they actually show an improvement or an elongation of meibomian glands. It's pretty exciting. Then there was actually, there's several studies that show improvement in inflammatory biomarkers like cytokine levels in tears, tear osmolarity. And so when you look at all this stuff together, we know that IPL heats the glands, there's a thermal benefit, and there's been studies show that it affects improved morphology of meibomian glands. We know that it removes telangiectasias. Why? Because that's what it was initially used for in rosacea. We know that it's actually absorbed by cytochrome C, which has anti-inflammatory effects of cellular function. We know it affects change in the osmolarity levels of tears. And the thing that I haven't really touched on, but is a huge benefit, is the major aesthetic benefits that patients are going to notice when you get it. So how do you make your staff believers? Well, do IPL on them. You know, the first couple of days of having it, you know, it's a little maybe apprehensive, but we did it and on one, and they started to see me do it on other patients, and now I have like a wait list for staff that want to do it. And so definitely has become a fan favorite for the staff. I'm going to zip through here. We're not going to, these are just two patients. You could see those videos on social media outlets of mine, patients that were just talking about how beneficial it was for them. So how do we do it? We identify the patient. We present them with some informed consent. We have pre and post checklists. We do a questionnaire, and then we Fitzpatrick them. So what is a Fitzpatrick? I had no idea. Is that some Irish guy at the bar? I don't know. Fitzpatrick scale is the scale of pigmentation in your skin and how your skin is changed with light. And so it's very, very important, as was mentioned, you know, in the beginning of the lecture, to make sure you understand what the skin pigmentation is, what the ethnicity is, and how that patient's skin has interacted with, in particular, the sun historically. And so there's a great questionnaire you could use. If this is something you're not familiar with, and you could see at the picture in the middle there, the 1, 2, 3, 4, 5 is a level of skin pigmentation. So it's not something you need to just guess on. There's standardized ways of doing it. So how are you going to get the patient ready? You're going to remove all their makeup. You're going to discuss the treatment thoroughly with them. You want to look at the patient a little bit differently. You want to look and see, do they have any moles? Do you have any areas where you think there may have been cancer, or was there cancer? Review that with the patient. Very, very important. You want to remove their contacts. You're going to put some anesthetic in. You're going to use the laser grade shields here. You're going to coat the eye with, coat the whole face with some ultrasound jelly. We just use, you know, regular ultrasound jelly. And everybody in the room should be wearing, protective laser eye shields. So it's a really easy setup on most devices. This is one of the devices on the market. You can, you know, you click, you know, what you're going to do. It's very, very intuitive. And so there's a couple different protocols out there. I just want to hit on this real quick. I know we're running low on time here. And so Toyos protocol is the one that you probably all heard of. Again, Rolando Toyos is the one who really sort of, I'll say, invented this. And so what is that? It's actually really a quick treatment. It's probably less than 5 minutes. You're just going to be using the device, this right here, with the larger light guide, and you're going to go from ear to ear. And so that is a really easy treatment. You're going to do it along the malar region right here. And that's what was really coined in the Toyos protocol. And many of his studies were just that treatment right there. If you're following the IPL literature at all, what you're going to see is there's several other individuals sort of taking it to the next level. One, of course, is Dr. Laura Perryman. And Laura, what she does is she actually treats the whole face. And the reason why she does that, and her analogy, and there's been studies done to show this, that you know, if the face was a garden, or think of the face like a garden, if you have weeds, in this case unhealthy blood vessels and vasculature adjacent to the area of concern, those weeds are going to travel or affect the quality of what's adjacent to it. So think of your face like a garden. You're going to pull the weeds around the garden, in the garden, and that affects what we're doing. So when I treat the full face, I'm treating dry eye, and this is why, and I explain that to patients. So she does a full face treatment. twice. She then does the Toyos protocol twice, and then she does the upper and lower eyelids with these shields in place. She then, at the very end, if there's any stubborn spots, will use stronger energy to do something called the aesthetic cleanup. And obviously very important. I think, understanding how it works, but also when not to use it is very, very important. And so, to really get all this is probably, a full day education or 4-hour, lecture, but I'm shoving some of it in here. So definitely skin cancers. African Americans really probably should not get this treatment. I've not treated any African Americans, any darker skin pigmentation. Previous herpes viral infection. Of course, we know herpes viral infections could be woken up by strong lights or in a strong issue. Pigmented lesions, skin fillers, Botox, not that you can't do it with them, but you don't want to do it in a very short period of time after the treatment because it's not set yet. So there's some contraindication there. Photosensitizing meds like Accutane, you're not going to want to do it on those patients. I have produced some pre-forms, so basically a really good informed consent. So if anybody's interested, I'm happy to share those informed consents. We have a patient initial included in my informed consent is a statement about video and photography. I photo every one of my patients before and after treatment, both from a a covering ourselves perspective, but also for educational purposes. And then I have some instructions for the patient for afterwards. We want them to make sure their skin is sensitized now. We want to make sure they're protecting their skin from light. So they want to be able to, apply a good quality sunscreen, wear a brimmed hat for at least a week after the treatment. We don't want them to come in with a sunburn either because their skin is going to be more sensitive, more red. There's going to be more target there for the light to be absorbed by, thereby potentially worsening that treatment and maybe ending up with some scarring or irritation. So we are just about at time. I have a little video I'm going to pull up here, and let's see if I can get it to work. Okay, so the video is about 5 minutes long. Let's see if I can get it to work here. Now it's a little silly, so you'll have to bear with me because I tried to edit it to make it a little shorter. So I'm going to zip through a couple things, just kind of show you the treatment. So we're going to start out with our treatment of our patient here with an anesthetic drop. So I'm going to have you take and then we give a artificial tear. We'll go ahead and take the laser grade shields here, place them on. So the way that I do that is I have the patient look down to the floor, straight down to the floor.
And then place the shield up underneath the upper lid, and look up, pull more of it down, and then just relax your skin there. And same thing on the other side. This is usually the worst part in some patients. Look down, good, just like that. Good.
Same thing. All right, so now we're going to put the ultrasound jelly on. This is your Zen moment of the day, I tell patients. I like to go ahead and put the ultrasound jelly on the entire face. Sometimes I do the forehead, sometimes I don't.
Just case by case scenario. I like the garden analogy and the weeds in the garden where, if you have weeds around the garden, they'll eventually end up in the garden. So it's a good thing to get the inflammation all around the eyes, including the upper forehead if you are able to. I can put just a little squirt on the upper lids. That's how I usually paint the face. And then I'll use my hand or glove to just get that all rubbed in. I like to just identify with the patient ahead of time if there's any areas of concern or areas where there may be pigmentation that we don't want to treat. So here you can
see there's little red vascular area here and pigmentation over on this side right here that we've discussed at past treatments, and he's okay with those disappearing. So over here you could see our setup. So we start out with skin typing the patient. The patient's a skin type 2. So the way you set this up, the way that I start with my treatment is a full face treatment of the treating the vascular condition. Most cases you're going to see redness associated with
rosacea. In some cases, you may see telangiectasias, where there are more visible blood vessels that are swollen. But if you see just sort of diffuse redness on the cheeks, nose, or other parts of the face, I use the erythema of rosacea. It tends to be a lower power than the telangiectasia, and it's usually a double pulse versus the rosacea telangiectasia is a triple pulse. So here for skin type 2, erythema of rosacea, and the we're going to push shallow. You can also do you can't do medium or deep, so it only does shallow, and we have the square light guide, and then it tells you what it's going to be. So here we press OK. So you have a double pulse, 16 joules per square centimeter is the fluence. You know, down here you'll see there's 0 pulses that have occurred, and the light guide is cooling. You can go ahead and press ready. It'll ask to make sure that you have the right light guide in. We have the 560 light guide, which is what is asked for up here. The current filter says 560. I usually just verify that with my staff. I usually like to just touch the light guide, make sure it's cool. It is. So we're ready to roll. I have my safety lenses on. So I'll usually just ask the patient, I'm going to go ahead and give you one pulse here to see if this amount of energy is okay. If it is, we're going to go ahead and rock and roll with the treatment. And I'll ask, especially in the first couple of treatments, if you know, the comfort is okay. So here we go. Ready? 3, 2, 1. Go ahead and press ready. 3, 2, 1. How is that? Okay. Is that okay? So if it wasn't okay, I'd back off a joule or two. Where it's 16, maybe I'd go to 14 and see how it was. Now I'm going to just place the light guide adjacent to that. How's that? Leave the square guide on, and I'm going to switch to the MGD settings. So you just press the little stethoscope, click by name, go to MGD2 for skin type 2. You'll see this is now a triple pulse with 14 joule or 14 fluence. It asks if you have the right light guide in. I don't. I have 560, so I'm going to take that out. I'm going to put 590 in. I'm going to press OK, and it's recognized that we're good. It's not active right now, so I could click it, and it's not going to happen, so I need to press ready, and we're good to go. So this is going to be a triple pulse. You'll hear
It's a little different sounding, and it should be a little more comfortable for the patient. Are you ready? All right, so here we go. So this is going to be a treatment from here to here, tragus to tragus, as we say. Again, the same thing, right over the nose. I like to come back on the lower cheek, do a couple more pulses there. And we're going to go ahead and do that again.
Good. All right, I'm back. So that is basically what I wanted to show you and share with you a little bit of how just kind of get familiar with it. For those of you that have never seen it before, didn't ever do it, you know, it's just kind of interesting, I think, to see it. Sometimes people jump when you shoot them, when you pulse the energy. Sometimes they squirm a little bit. It's a sharp feeling. You should try it yourself, okay? And so it's interesting. You know, some people are stoned, they just sit there, and others, you know, kind of jump a little bit. And so, you know, the thing about, you know, I think that the device that I use, it has OPT or optimal pulse technology. That's really that setting that I was just talking to you about, that pulsing, being able to attract the effect into certain levels and areas. The tip is very important, how it cools, how it provides for comfort at the skin, and those are the very important things about you know, the units that you should look at. And so, you know, obviously, guys, right now is a crazy time. You know, there's there's adversity really at every corner, but certainly I think there's a lot of opportunity. You know, I'll share with you, we're going to be opening a third office in a very short period of time. We're hopefully going to be closing on it and looking at you know, expanding. Why? Because you know, people need us. People need doctors of optometry. They need eye care. Lots of folks suffering from dry eye. Lots of people, you know, with glaucoma, macular degeneration that need our care. And so, you know, thank you for all of you for stepping up, helping folks with emergencies and urgencies throughout this very difficult time. And hopefully, you know, as we turn the corner and start to open up and get back to some new sense of life here, you're able to also seize the opportunities that probably have presented themselves. You know, I've spoken to a couple people about this technology, you know, since everything's been going on, and definitely some concern about doing it in this time. I can tell you I've been very successful in doing it, I think, in a very safe and effective way. I do have the patient remove their mask, do the treatment, clean them up, put the mask back on. I spray their entire face with a hypochlorous spray afterward and before, and we do the treatment as we have. And I've done, you know, I did 4 today, and so I think it is something that's been a great addition to our practice. And so without further ado, I will answer some questions. NJSOP, thank you so much for having me. It's been a total honor.
Great job, Jimmy. I'm going to summarize some of the questions, which were a little repetitive, but there's been some questions pertaining to the use of the shield. Can you touch on that?
Yeah, so really there's two ways that you can do this treatment. And so all of the studies really going back to probably 2 years ago were done with folks that did not have shield. What they had was a little sticky, a laser grade sticky that went over the eye. And so really all of the dry eye studies done prior to just a couple of years ago were done, no one actually treated the lids. And so, you know, recently there's been studies then repeated with the laser grade shield. And so basically this is almost like a big scleral lens. So it's got this little handle on it, but you're going to place it in like a big scleral lens. So you numb the eye and then you're going to put this on it. It's made in such a way that it vaults the cornea. So it's just going to be landing on the sclera, just like a scleral lens. And then you have control of it. You can kind of maneuver it with this little handle. And patients, you know, they don't love it, I'll be honest, but it's definitely a surmountable situation. And I think, you know, if we're going to be treating these patients, we should be treating at the area of concern directly on the lids where the vascular supply is. And now there's been studies to show that it's beneficial and safe.
All right. Another question, again, I'll leave the last one here, kind of talked about the protocols for treatments and, you know, patients' understanding or response to treatments and appropriate follow-up, and about how many treatments roughly for the patient to be satisfied, and do you repeat it annually or?
Yeah, great question. So, you know, again, there's a lot of buildup, I think, with this. Again, it's a new thing. It's something patients are not familiar with. So that I think videos are key. I think pamphlets are key. I think probably dropping, you know, little seeds of knowledge on patients over time is key. And so, you know, once they sort of get sensitized to this idea, or maybe they hear a friend that's had it, then we discuss the actual treatment. So, you know, I say, all right, you know, the way that this works is I'm going to give you, you know, this form. It's an informed consent. I want you to review it. I will review it with you. You're going to fill that out. And then we're going to go over, you know, the treatment itself. Treatment itself, come in, no makeup. We're going to do the treatment. It takes the first time, maybe 15 minutes. Times after that, 5 minutes. We are going to do it every 2 to 3 weeks. So I kind of give a little bit of wiggle room every 2 to 3 weeks for treatments. And so I think there's a lot of different ways that you can do it. You can say, well, we're going to take one price for all 4 treatments, or we're going to, and maybe we'll discount it a little bit, or we're going to just pay as you go and do 4 treatments. But I have in my informed consent that the patient admits to, unless there is a medical reason, getting 4 treatments, because from the studies that I've observed, it's been 3 to 4 treatments that have shown that benefit. I tell the patient there's no guarantee. Of course, with anything in the medical world, there's no guarantee. However, it may need to be retreated at 6 months and 1 year for maybe a two pulse treatment. In other words, maybe one time and then wait 3 weeks for the second time. And so that's how we've been positioning it, and patients, have been very open to that.
All right. The rest of the questions I can answer it myself by saying that, this has been posed to the state board as, is it something that optometrists can do in the state of Jersey? And our state board has come back and responded that, yes, this is within our scope of practice. So, yes, this is a treatment that is available to your patients, but there's no CPT code for this. So it is a fee for service. And I think we'll leave it at that. So
Air high five. Good job, New Jersey.
I'd like to conclude by saying, Dr. Deom, thanks for your expertise.
Thank you.
As always, as a reminder, all attendees will receive a 1-hour COPE credit, and your CE cards will be emailed to you within the next week, along with a link of today's recorded webinar. If you would like additional information on Lumenis's IPL or how to add this technology to your practice, you can contact Brittany Taylor, Lumenis Vision Area's sales manager for New Jersey. We will include her information for contact in the post-webinar email that will be sent out in the coming days. That concludes the webinar. Thanks all for attending, and have a great night.